I'm Joyce Harrell. I'm a dietitian and diabetes educator, and I've been in the diabetes world about 18 years now, working with patients to help them achieve better control of their blood sugar. It's a very tricky process in a lot of ways, but I try to make it as simple as possible. What really happens is that you are on your own journey to figure out what's going to work best for you, because what works for you may not work for the person next door to you, around the world, or even your neighbor. So you take it one step at a time, try to figure it out on what's going to work best, and you can achieve really good blood sugar control most of the time. Everybody says it's about the food. In fact, the food is only one factor in what happens with blood sugar control. When you look at things, what we see is that blood sugar is impacted by your exercise. Does that show? The exercise you do, the medications you take, the stress level in your body, hormones in your body, whether you're dehydrated or not, any medications that you're on, whether they relate to diabetes or not, and some other factors. So the thing is, the sugar comes not just from the food, but your liver also puts sugar into your bloodstream, and your kidneys put sugar into your bloodstream. So there's a lot of things going on to impact your blood sugar that have nothing at all to do with food. So that's why I think worrying so much about food is actually a little bit on the crazy side. Your pancreas is the organ that makes and releases insulin. And it does that around the clock, 24 hours a day, 7 days a week. So we need to make sure that it works as well for us as it can. Then you have the cell, which is involved in blood sugar control. And the cell is actually how we get the sugar to work for us. We have insulin that attaches on the outside of a cell, which allows the sugar to go inside that cell through that opening that the insulin creates. We have medications, obviously, that can impact your blood sugar to help make it better controlled. We have injectables, it's insulin, and then your things like your incretin mimetics. Then you have all of the oral medications set up in different classes, trying to get your blood sugar better controlled from one day to the next, and actually even 1 minute to the next. So once we get that in better control, what will happen to your blood sugar is something more like this. When you have a carbohydrate by itself, it doesn't matter which carbohydrate, the blood sugar shoots way high real quick and comes back down. When you add meat and fat to the carbohydrate, the impact on your blood sugar is actually more of a curve. It goes up, hangs there for a while, then it will trend down. So eating carbohydrate plus meat plus fat every single time that you eat improves your blood sugar significantly. And how do we know that? Well, you test your blood sugar, and you test at certain times. The guidelines for blood sugar control are set by the American Diabetes Association and also the American Association of Clinical Endocrinologists. And each of them have guidelines set for each time of the day. Fasting in the morning for the American Association of Clinical Endocrinologists, the goal is 70 to 110. Then right before a meal, the goal is 70 to 110. 2 hours after a meal, they expect it to be back down below 140. So if you compare what it should be before that meal to 2 hours after that meal, what you see is an expected increase in the blood sugar of anywhere from 30 to 70 points. If that's all your blood sugar rises in a 2-hour time frame from eating, then in all likelihood, what you're eating, your combination, your amount, is working fine for you. Why fix what isn't broke? The one thing that can clearly impact that, obviously, in terms of food, is if you have a high fat intake. A high fat intake may not cause a rise in the blood sugar for 3, 4, 5, or even 6 hours for that matter. So you do want to have a good combination, and again, we're looking for the rise in the blood sugar of 30 to 70 points. So I have created a form to use that will help you to establish what works best for you. And you test particular meals to see the impact from that particular meal on your blood sugar. Once you have that information, then it's easier to make changes to a particular meal to get better blood sugar control. We are all creatures of habit. We tend to choose the same kind of food from one day to the next, one meal to the next. Once we know the impact on our blood sugar from what we're doing now, we do not have to micromanage food. We can make it about just living.
How did I get diabetes?
Well, diabetes is a metabolic disorder. We're all living longer, and so basically we're kind of wearing out the pancreas the longer we live. Most of us have been raised on cereals and higher carbohydrate type meals. We're not as active as we used to be, and that obviously can impact your blood sugar control. And so we're basically just outliving our pancreas.
How many people in the U.S. have diabetes?
Currently about 29 million, and that is as of 2014. That continues to rise, and close to about the number who are diagnosed with diabetes have pre-diabetes and don't even know they have diabetes, or pre-diabetes for that matter.
Where does the sugar or the glucose come from?
It comes from the liver, the sugar that we eat, the food that we're eating, and from the kidneys, which also put sugar into the bloodstream.
What impacts blood glucose?
Food, obviously, but also medications, whether they relate to diabetes or not, your activity level, your hydration status or the lack thereof, your stress hormones, well, stress in the body, and then hormones in the body, all of that impact your blood sugar.
How about food impact on blood sugar?
Well, when you have a carbohydrate, and again, it doesn't matter if it's a piece of fruit or a slice of bread, the blood sugar rises very rapidly, and it will hit a high spike, usually within 1 hour, and then it's back down at the 2-hour mark. But then your carbohydrates, those again are the ones that have the most impact, but even your meat and your fat to some degree are going to impact your blood sugar.
What's glucose load?
The glucose load is actually what happens to your blood sugar from eating a particular meal or particular type of meal.
Okay, how about that glucose index?
Glycemic index is actually a pretty cool thing when you look at the big picture. What they do is they take one item at a time, they evaluate the impact on the blood sugar, and any food that has a higher impact on the blood sugar has a higher number on the glycemic index. My only major beef with the glycemic index is that there is no real research showing the combination of carbohydrate plus meat plus fat of different meals on different individuals with all of the other variables that go into what may control blood sugar.
Monitoring your blood sugar, why is that important?
It shows you exactly what's happening to your blood sugar from what you do. And your blood sugar rises and falls all day long anyway. People again have focused on food until they're so focused on it they're not getting control, and they're beating themselves up because they eat well, they don't eat as much as what they'd like to, they don't even eat the foods they'd like to, and still their blood sugar is not well controlled.
What should a diabetic's blood glucose goal should be? What should it be?
Ideally anywhere from 70 to 140 all day long, within that range.
What meds can you take or pills to help your diabetes?
We have a lot of different classes of medications. Some act on your pancreas to make it put out more insulin around the clock. Some act to suppress the digestion of carbohydrates to lower your blood sugar. Some act on the muscle level to make the cell more sensitive, the muscle cell more sensitive, to allow the sugar to get inside a cell. The classes are designed to do a lot of different things, but when you look at the shotgun approach of treating diabetes with the pills, that's really kind of what you're getting, a spread out approach. You don't know if it's really working on your blood sugar again unless you test. Insulin, on the other hand, is exact. It always lowers blood sugar. So it's like using a 22 or a 25 versus a shotgun in terms of, are you going to control the blood sugar or are you not?
How about medical or medication injections?
Yes, well, insulin is obviously an injection. That's really the best way to get it into the body. But there are other classes of injectable medications. They're called incretin mimetics. And they work in a few different ways to help lower the blood sugar by trying to promote the pancreas to work better and trying to prevent your body from putting out so much sugar into your bloodstream.
What about this A1C?
The A1C has been around a few years now, and it's basically a 3-month measure of what your blood sugar is doing. And again, since blood sugar goes up and down all day long, it's measuring the past 3 months. Half of that number is actually from the month right before this test is drawn, 25% is from the month before that, and 25% is from the month before that. So again, it's a 3-month measure. And the range that is associated with any particular A1C value is how you're really operating most of the time. Many of us have a tendency with a good A1C of, let's say, a 6.5 to 7, our average blood sugar is probably going to be 126 to 150 with that A1C. But the blood sugar goes then anywhere from probably 65 on up to maybe 200, even for an A1C of 7%.
Finally, how much exercise is good? Or how does it help me?
Well, exercise makes the cell more sensitive, and it does it for a full 24 hours. So any amount of exercise you do today works for the next 24 hours to improve your blood sugar. If you're trying to lose weight, the studies show that 35 minutes of exercise every single day of the week will get you the biggest bang for your buck. Clearly, though, if you're on insulin, if you're taking too much insulin, that's going to promote weight gain. But if you're on the right dose of medication, especially insulin, the right approach to eating, controlling blood sugar from eating, and then getting the exercise on a daily basis and doing things that help your entire body, that's going to get you the best benefit.
Do you have any final words?
Just do it. Pay attention to it, because your body's going to give you a clue about what's working for you and what's not.
Thank you.
Thank you.